Good morning, I'm Joe Fryer. Savannah has the day off. Right now on Morning News Now, battle plan. With the Omicron variant running rampant, President Biden now promising to expand testing and calling on Americans to get vaccinated and boosted, and delivering this message to the millions who remain unvaccinated.
Get vaccinated now. I promise you, it saves lives. And I honest to God believe it's your patriotic duty.
The new steps some cities are now taking to meet the demand for testing and get more people to return for a booster shot. Under pressure, the stress of the nation's hospital workers rising along with COVID cases. They've been fighting the pandemic for nearly 2 years now, and for a lot of them, it doesn't feel like it's getting any better. The problems hospitals are now facing as they gear up for this new wave. In limbo, families across the country are getting their final child tax credit checks. The pandemic financial aid is ending just as COVID cases are going up. What the future holds for this benefit now that President Biden's Build Back Better plan has hit a wall. And the rental clause. More people are choosing to rent their Christmas tree, take home a real tree, decorate it, and return it after the holidays. We'll take you inside the program and the major impact it's having on the environment. Good to have you with us today. We want to begin this morning with the COVID-19 pandemic as cases across the country surge, fueled by the highly contagious Omicron variant. Speaking yesterday, President Biden said we should be concerned by the new strain, but he also reassured Americans that the country is now better prepared than it was at the beginning of the pandemic. The president announced new measures to ramp up COVID testing and urged those who are not yet vaccinated to get the shot as soon as possible.
If you're unvaccinated, you're at a higher risk of getting severely ill from COVID-19, getting hospitalized, and even dying. So the best thing to do is get fully vaccinated and get your booster shot. And no, this is not March of 2020. 200 million people are fully vaccinated. We're prepared. We know more.
NBC News White House correspondent Mike Memoli joins us now. So, Mike, we've heard this message to get vaccinated many times before from the president, but he seemed to really go after those who've held off getting a shot this time, didn't he?
Yeah, Joe, that's right. There's a very specific audience that the White House had in mind for the president's address yesterday. They think it's the majority of Americans who've been vaccinated, have largely been doing all the things that they've been asked to do throughout this pandemic to try to put it behind us, like wearing masks and the like. And they know that that audience is extremely frustrated that we're still dealing with these kinds of restrictions. That's why the president said he shared their frustration. Now, part of the White House's calculation is that that audience wants to hear some criticism of those who are really, in their view, responsible for us still being in this position, and those who aren't who are unvaccinated. Here was the president's message to that audience.
All these people who have not been vaccinated, you have an obligation to yourselves, to your families, and quite frankly, I'm not going to get criticized for this, to your country. Get vaccinated now. It's free. It's convenient. I promise you, it saves lives. And I honest to God believe it's your patriotic duty.
So, Joe, let's be honest, that holdout group, those who haven't been vaccinated, those who are protesting mask, vaccine mandates and the like, maybe weren't watching the president live yesterday, but the president still had a message for them. He brought up the former president, Donald Trump, the fact that he got boosted. He also gave his administration credit for putting the U.S. in the position of having a vaccine earlier than so many other countries. It's a message that maybe they didn't hear in real time, but maybe they will down the road.
Yeah, we'll see whatever it takes at this point. Now, the Biden administration, Mike, has been criticized by some for being too slow when it comes to making COVID tests available. So how is the president planning to try and ramp up testing?
Yeah, this was a speech yesterday that was designed to show that the administration is on offense regarding the pandemic, but the president was clearly on the defensive on this issue of testing. He laid out what the administration is doing, making these take-home tests available to anybody who requests them, also ramping up the testing sites around the country, including the first one opening this week in New York. But it was obvious that he was defensive when asked about why these measures weren't taken sooner. He explained that, listen, anybody who told you that this variant, the Omicron variant, was going to replicate and become the dominant strain so quickly, you would have thought that they were crazy. Now, a lot of people don't think that's the case. And remember, Vice President Harris said something similar a few weeks ago, walked that back. So this is an issue the White House is going to be explaining their way through for some time.
Now, Mike, the rise in hospitalizations we're starting to see is coming at the worst time, with many hospitals. They're understaffed, they're overworked. Will we see more action from this administration, from the federal government in the coming days or weeks to address that specific problem?
Yeah, obviously the big headline yesterday was revolving around the issue of testing, but the White House also taking very important steps to try to aid that very strained, overstrained healthcare workforce, doctors and nurses, some of whom have even left a lot of these hospitals, which is going to be an issue as we see the numbers rise in the coming weeks. And so that's why the president is deploying 1,000 military doctors, medics to surge areas where they determine that they are in the need the most. The Department of Defense will be doing that as needed, they say. They haven't done anything yet. It's likely that they will not be able to do so until January or February at this point. But the White House is also saying that FEMA is going to be surging some response teams to also add beds and the like to make sure that these hospitals, which continue, we see the numbers rising on a daily basis, will have additional capacity should they need it.
All right, Mike Memoli reporting from the White House. Thanks so much, Mike.
Thanks, Joe.
Now, cities throughout the U.S. are scrambling to boost their COVID testing capacity as the Omicron variant sweeps across the country. Many Americans hoping to get tested for the virus have been forced to wait in long lines at testing sites. Some are also faced with a shortage of rapid testing kits in pretty much every store they visit. NBC News reporter Gary Grumbach is outside one of those testing sites in Washington, D.C., which gives us really an idea of what's happening in a number of major cities right now. Gary, good morning. So what is that city's plan to get more people tested for the virus?
Hey there, Joe. Yeah, we've seen this scene before major holidays over the past 2 years. Long lines at testing sites, but with nothing like what we've seen around the country over the past few days. DC Health has seen it too. We're here at Farragut Square. They've been having a PCR testing site here for the past 2 years, really since the pandemic began. I'll tell you, there's already a few people in line. This site doesn't even open until 8 a.m. But DC is starting to ramp up their rapid testing capabilities. They're starting what they're calling Test Yourself Express today. There's 8 libraries across the city of Washington, D.C. that are going to be handing out 1,000 free rapid tests. You can get them at the library if you're a D.C. resident, take them home. It takes 15 minutes to take the test. That's part of what they're doing here in D.C., along with what you were just talking with Mike about on the federal level.
So, Gary, we know Washington, D.C.'s Mayor Muriel Bowser, she's announced a new plan to expand the city's testing capacity. What more can you tell us about that?
Yeah, it really does seem like D.C. Health and health departments across the country were caught a little bit flat-footed with just how fast Omicron is spreading. And because of that, people may not want to wait 2 or 3 days to get the result. So they need the rapid tests. Right now, D.C. has 40,000 rapid tests on hand. They say there's 200,000 in transit. This week, Muriel Bowser announced 1 million rapid tests are on their way to D.C. in an order just placed, but those won't come until January. Joe?
Gary, as cases rise in the nation's capital, what is the city doing when it comes to a mask mandate?
Yeah, Joe, if you've been following D.C. health regulations pretty closely, you'll remember that there actually was a D.C. mask mandate just before Thanksgiving. Mayor Muriel Bowser then lifted that mask mandate, and it only lasted about a month. This week, it is back in place in all public places indoors. Of course, that never left in places like hospitals or schools, but it's now everywhere indoors in public places. But just anecdotally, I'd say it really never left at all, because whether you're in a Trader Joe's or a supermarket or a shopping center, it really did feel like people were wearing masks throughout the past few months.
Gary, I mean, we're just a few days away from Christmas there in D.C. What's it like? Are there a lot of people there? People left town? Do you get a sense that people are changing their plans? What's sort of the mood and environment there?
Yeah, D.C., as you know, Joe, is a real transient city. There's a lot of people coming in and out, of course, to their districts if they live on Capitol Hill or, elsewhere. And so right now it's definitely an emptier city. But when they come back, they're going to be coming back from across the country where COVID is spreading at various rates. So that's something to look for, too, after the holiday week.
All right, Gary Grumbach reporting from the nation's capital. Thank you so much. Now, the recent sharp rise in cases is pushing thousands of patients into intensive care units that are already overwhelmed. In response, healthcare workers are now pleading with the public, asking all of us to take more precautions against COVID. The average number of daily COVID hospitalizations nationwide, nearly 69,000. That's up 14.2% in just the last 2 weeks. ICU hospitalizations, intensive care units, are up just over 9%. Doctors and nurses are at their limits, reporting exhaustion and fatigue as they face yet another COVID wave. Let's bring in NBC News reporter Daniela Silva for more on this. Daniela, we've seen healthcare workers express exhaustion and fatigue throughout this pandemic, starting in March of 2020, now again. Does this feel different this time around for healthcare workers? What are they seeing inside their hospitals right now?
Good morning. Hospitals told me that they are once again seeing their numbers skyrocket, and some are at a breaking point. This time, the surge is fueled by the arrival of the highly contagious Omicron variant, the ongoing battle against Delta, unvaccinated patients needing treatment, and managing a shortage of much-needed staff. One health official told me in the Minneapolis area, there are 200 to 400 people every morning in emergency rooms waiting for beds they need to open up. A hospital there brought in a refrigerator truck to help its morgue capacity. Cleveland Clinic in Ohio said many ICUs and emergency rooms are at 100 to 120% capacity.
And that's what we're seeing right now, and we know there's still going to be even more cases going up after the holidays, especially with the number of families getting together. I want to talk about Massachusetts. Just yesterday, the state announced it will be calling on the National Guard to help with the surge of cases. Let's take a listen.
Hospitals across Massachusetts are experiencing an unprecedented demand, and there remains a critical staffing shortage in many jobs and many roles to meet the needs of our patients. We're committed to ensuring our healthcare system meets the acute care needs of our residents. To support hospitals that are experiencing staffing shortages, the governor is activating up to 500 members of the Massachusetts National Guard to ensure sufficient non-medical personnel are available to deliver support to patients.
Daniela, how are these staffing shortages impacting care in states that are just so desperate for help right now?
Yeah, healthcare officials told me the staffing shortages right now are a national crisis, compounded with wave after wave of COVID cases. In Rhode Island, one wrote a letter to the governor saying emergency departments were reporting anywhere from 25 to 50% of their nursing positions vacant, and inpatient units were equally starved for staffing. At Cleveland Clinic, officials said they haven't had enough nurses, enough personnel to just deal with the surge of patients. They said the healthcare community's biggest fears right now are patients dying because of treatable illness or not receiving the appropriate care they need because of these shortages.
So, Daniela, with Omicron now the dominant strain in the U.S., quickly becoming the dominant strain, how worried are healthcare workers about the weeks ahead?
Healthcare workers told me the next few weeks are exactly what they fear as Omicron cases rise, while many are still battling the Delta surge too. In Massachusetts, one official described it as an impending sense of doom. Others have said they're really terrified of what's to come, and they can't imagine having to treat more patients than they are now.
All right, Daniela, you can read more of her reporting on NBCnews.com. The headline, "I am terrified right now." That's a quote from a healthcare worker she spoke with. Thank you so much. Let's bring in Johns Hopkins Center for Health Security senior scholar, Dr. Amish Adalja. Doctor, good to have you with us this morning. So as we just heard, hospitals being pushed to their limits again. What do you think of the president's plan? Will it do enough to try and slow down the virus and help out the frontline workers?
The most significant part of the president's plan is the way that he's mobilizing federal assets to help hospitals that are in hard-hit areas, to make sure they have capacity, to make sure they have staffing. That's going to be the most welcome part of that. We know that the next couple of weeks to maybe a month or so is going to be rough. Hospitals are already getting crushed with Delta, and now they're going to get Omicron patients. The antiviral that may be getting approved in the next day or so, that's also going to play a big role. But we have to remember that this is going to be a very hard thing to completely stop because Omicron is spreading very quickly, and we still have a large swath of the population unvaccinated, therefore susceptible to hospitalization. So it's going to be kind of touch and go at certain hospitals in certain parts of the country. It's probably not going to be a systemic problem, but a regional problem that can be very, very difficult to easily solve.
Doctor, with Christmas just a few days away, testing is on everyone's mind. When it comes to the increased demand we're seeing for those COVID tests, how do you think the federal government is doing to meet the challenge of getting more Americans tested? Did what the president announced yesterday, is that going to help, or might it be a little too late in this process right now?
It's definitely too late. This is something we needed a month ago. This isn't something new. We've had shortages of home test kits for a long time. I can remember a couple of months ago having my friends drive to outlying counties to try and find tests. It's not easy to do. And this is something that should have been anticipated. Throughout this pandemic, we've always under-tested and undervalued testing during the prior administration and even during this administration. So what we have to really do is optimally use these tests so that people can navigate their lives, so that they can go about the world in a world in which there is a pandemic going on, but have minimal disruptions. So when these things start to come around in January, the 500 million tests start to arrive, a lot of people's need for them now for Christmas break is going to have already expired. So I think we have to really think more proactively about this, and it's going to be difficult because these tests are not going to be in great supply in the next couple of weeks.
It is hard to believe we are this far into the pandemic and still having testing issues right now at so many different levels. For those Americans out there who've not been able to get a test yet, but they think they may have been exposed to the virus, what advice do you have for them, especially if they are or maybe they were planning on spending time with their families over the holidays?
Well, I think, first of all, if you're vaccinated, realize that you're going to have a very mild illness. And if you can get a test to clear yourself, to be able to be around people, that's going to be important to make your gathering safer. If you're unvaccinated, you're probably going to have a hard time clearing that virus within that 10-day period of isolation. I think I would just tell people to be tenacious. You can maybe find tests somewhere. Maybe one of your friends has tests that they've stocked up. Use the online ordering at some of the big box retail stores. You got to really just be innovative. And it's unfortunate because this is something that the government should have anticipated and made it much easier because they knew that this was going to be a disruptive force.
Dr. Adalja, for those who maybe haven't been exposed, or at least that they know of haven't been exposed, but are just anxious and they're debating, they're supposed to leave a day or two from now, and they're wrestling with that decision right now, what are the things you want them to think about as they try and make that decision?
If they're fully vaccinated, I think they should and they don't have any symptoms, and they've not knowingly been exposed, I think they can go about their holiday normally. I think that hosts of these holiday gatherings need to come up with a policy or an idea of who they're going to test and who they're not going to test. I don't think it's necessary to test every vaccinated person who has no symptoms, but that's based on the risk tolerance of the people having the gathering. The safer the gathering, the more vaccinated people that are at these gatherings, the safer they'll be. So in that situation, I don't necessarily think you have to test. It's when you've got mixing with unvaccinated individuals, when you've got people who have been exposed, that's where the tests become much more valuable. But for unvaccinated people, I think they can basically go about their holiday free from the worry that COVID is going to be serious, even if it does occur in one of the guests there, because that's the point. We're on a two-track pandemic. Vaccinated people have very mild illness, and that's to be expected. It's the unvaccinated that we worry about because they have the ability to crush our hospitals.
All right, Dr. Amish Adalja, as always, we appreciate your expertise and your advice. Thanks so much. Now, with those hospitals pushed to the limit by this latest wave of COVID, as we just heard, the Pentagon is preparing U.S. troops to join the battle. Their mission, helping out exhausted healthcare workers across the country. NBC News Pentagon correspondent Courtney Cubie has the details.
On Tuesday, the Biden administration announced that they had directed the Pentagon to prepare up to 1,000 members of the U.S. military to deploy across the country to support the outbreak of COVID. Now, there already are about 250 members of the U.S. military spread around the country in 7 states at about a dozen civilian medical facilities. They're there supporting the local medical staff, who in many cases are just overwhelmed by the number of COVID cases that they're seeing on a daily basis. You may remember early on in the pandemic, the military deployed these large groups of medical professionals around the country to help support with the outbreak. Well, what they learned in cases like sending the USNS Comfort up to New York was they just didn't get that many patients. They realized that they were much more efficient by sending these small medical teams around the country to civilian facilities to help these overwhelmed local doctors and nurses. That's what they've been doing. Most of the teams are about 20 people. They go, they move into the civilian facilities, and they just augment the medical personnel there that, again, are just overwhelmed by these outbreaks. Now, we don't expect the first numbers of these 1,000 people to actually be moving out to these facilities until January or maybe even February. What they're waiting for is FEMA to put in the requests for what they need and where they need it. Again, defense officials expect these to be smaller teams, somewhere in the neighborhood of 20 people, largely doctors, nurses, and paramedics that will move into civilian facilities, and they will help these overwhelmed local staff.
Thank you, Courtney. Let's get a check now on your morning news now. Weather, Michelle Grossman is with us. Michelle, good morning.
Good morning, Joe. Happy Wednesday. And we are looking at some snow for some and a lot of snow. We're talking about measuring in feet. But first, let's start in the New England area. We're talking about inches there, generally 2 to 4 inches in some spots, but some spots could see over 8 inches of snow. So we do have winter weather advisories, winter weather warnings. That's in the pink in northern Maine. As we see a coastal low, that's going to bring some snow today, even some rain and ice from Long Island to Maine. That's what we're going to be watching in the northeast today. Otherwise, as we look towards the snowfall totals, I mentioned over 8 inches in some spots. I'm sure lots of northern Mainers are very happy about that. Now, as we scoot to the west, we've been so active this month that we're going to continue to be very active over the next several days. So we're looking at a series of storms moving inland, and we're looking at a ton of winter storm warnings, a ton of winter storm watches as we stretch from the Pacific Northwest through California into the Intermountain West. And this is where we are measuring the snowfall in feet. So you can see generally 6, even up to 12, 24, and over as we look at the higher mountains of the Sierras. Now, we have quite the contrast, though. So we have the snow in parts of New England. We have the snow out to the west, and that will remain very active over the next several days. And then sandwiched in between, we are so above normal. We're going to continue to see these temperatures very, very warm today, tomorrow, Christmas Eve, and also Christmas. So as we look at the temperatures, Denver, 22 degrees above normal for this time of year, 64 degrees. Today in Lubbock, 69. That's 18 degrees above what is typical for this time of year. And San Antonio, 73. And then look what happens tomorrow. It sort of just expands. You can see those colors on the maps, the pinks, the oranges, indicating that very warm air in place. So Midland, Texas, 81 degrees tomorrow. That's Christmas Eve with 25 degrees above normal for this time of year. 73 in Dallas and 77 in Austin. Then we're going to see this heat move off to the north and east. So by Christmas Day, we're going to be very, very warm in parts of the mid-Atlantic. Washington, D.C., you could be close to 60 degrees, while we're going to be turning colder and more average in parts of the Great Lakes into the upper Midwest. Look at the upper Midwest. Pretty chilly on Saturday, 26 degrees, below freezing on Sunday, 28. Still in the 50s and 40s in Chicago and Cincinnati, we're looking at 60 degrees. So we're all across the board in terms of the weather. Joe, when I come back in just a bit in the next hour, we're going to talk about travel forecasts. We're looking pretty good, but we do have some travel spots across the country.
All right. A lot of folks will want to hear that. Michelle, thanks so much.
Yeah.
Coming up, new threats this morning from Russia against Western countries. Vladimir Putin is telling them he's ready to take military action if NATO tries to stop him from putting his troops along the border of Ukraine. What the growing tensions in Eastern Europe mean for the United States. Next. Just 12 hours into deliberations, the jurors in the trial of former police officer Kim Potter emerged with 2 questions, and one of those inquiries is raising speculation about the possibility of a hung jury. Take a listen.
The first question is, if the jury cannot reach consensus, what is the guidance around how long and what steps should be taken?
The judge instructed them to continue discussing the case. She said the jurors should not hesitate to re-examine their views, but also should not change their opinions simply to reach a verdict. Potter is charged with first and second-degree manslaughter after shooting and killing 20-year-old Dante Wright last April. She's pleaded not guilty to both charges. The veteran officer says she was trying to deploy a taser but accidentally pulled her gun before firing the fatal shot. Jury deliberations began Monday after nearly a week and a half of emotional testimony and will continue later today. Jury deliberations will enter a second full day this morning in another high-profile trial, the case of Ghislaine Maxwell. The former confidant of Jeffrey Epstein is charged with federal sex trafficking, accused of conspiring to help Epstein sexually abuse young girls. Maxwell has pleaded not guilty to all charges. She faces up to 80 years in prison if convicted. We get the latest from NBC News Now correspondent Dasha Burns.
Joe, no verdict in this case yet, but let me walk you through what we know of these deliberations so far. First, the jury is comprised of 6 men and 6 women. Yesterday morning, they asked to see the full transcripts for 3 of the accusers who testified. Now, the prosecution's case is really focused on the stories and on the testimony of 4 women. And so whether or not the jury believes these women, finds them and their stories to be credible, that is going to be critical in their decision making. The second ask was to see some FBI notes from an interview with one of the accusers, Carolyn, going by just her first name. The judge denied that request, but this is a topic that came up when the defense cross-examined Carolyn. And the fact that the jury is asking for this just shows that they are engaging with the case that the defense is making as well. And then finally, they also asked later in the day if the jury could consider Annie's testimony on conspiracy to commit a crime under counts 1 and 3. Now, looking at the counts, count 1 is conspiracy to entice minors to travel to engage in illegal sex acts. Count 3 is conspiracy to transport minors with intent to engage in criminal sexual activity. That's 2 of the 6 counts. This conspiracy idea is a complicated legal concept to really pin down, and so that's what the jury is really working through right now. They finished up their deliberations a little bit early, finishing up at 5 o'clock and asking the judge if today they could start deliberating at 9 a.m., finish at 4:30 p.m., and the judge did bring up the idea of deliberating on Thursday, tomorrow as well, if they do not come back with a verdict today, Joe.
Dasha, thank you. This morning, Vladimir Putin is making new threats against NATO as Russia continues to mount a huge military force on the border with Ukraine. The U.S. is responding, and officials say they're preparing for more potential threats to come. Here's NBC News Chief Foreign Affairs Correspondent Andrea Mitchell.
New threats from Vladimir Putin, surrounded by his generals, demanding that NATO withdraw its troops from Eastern Europe. He says in case Western colleagues continue their clearly aggressive line, we will take adequate military and technical measures in response. He's got the military muscle to back it up. More than 100,000 troops plus tanks and heavy equipment at the Ukraine border. A buildup that has only increased in the 2 weeks since Putin and President Biden met virtually.
Since the president talked to President Putin, it seems as though the buildup is continuing, the threats are continuing from Vladimir Putin.
If Russia continues to engage in reckless or aggressive actions, we will respond, and we'll respond strongly.
The U.S. approving a sale of Javelin missiles to Lithuania near Russia. And U.S. officials confirm they are on high alert for an even tougher threat to counter, a Russian cyber attack, turning off the lights in Ukraine as it did in 2015 and 2016.
It allows them to attack without doing a full-scale military intervention in Ukraine. It sounds like he's preparing for some kind of attack. Cyber gives him the option of starting an attack without going to full-scale war, and that's a place where Russia has great advantages.
That was Andrea Mitchell reporting. Coming up, it's a scene we're seeing across this country. People are waiting hours to get tested for COVID. And if they want an at-home test, well, those are hard to come by. But in one state, the program has been underway for months, making it easier for people to get tested. We'll show you what they're doing and how it could be implemented elsewhere. That's next. If you're traveling by car for Christmas, chances are you'll likely hear a holiday song on the radio. It's pretty much unavoidable. Well, an Irish insurance company has released a list of what they call the most dangerous Christmas songs to drive to. Here's the top 5. Coming in at number 1 is Frosty the Snowman. That's followed by the Mariah Carey classic, All I Want for Christmas Is You. Rounding out the top 5, Feliz Navidad, Santa Claus is Coming to Town, and Let It Snow, Let It Snow, Let It Snow. So what makes these songs so dangerous? At least according to this one company, the list is based on the number of beats per minute in the songs. For example, the number 1 song on the list, Frosty the Snowman, has 172 beats per minute. According to a scientific study, songs that have more than 120 BPMs are linked to increased dangerous driving and potentially leading to accidents. With that, let's take a look at what's making news around the world this morning. NBC's Claudio Lavanga joins us. Claudio, good morning.
Good morning, Joe. Well, at least one person was killed after a massive landslide at a jade mine in Myanmar. At least 25 people, mostly miners, were rescued and taken to the hospital, but authorities fear that 100 more may be missing and that the death toll may consequently rise. Moving to this part of the world, Hans Kluge, the European director of the World Health Organization, has warned countries to brace for a significant surge in Omicron cases as the COVID-19 variant is spreading fast across the continent. Kluge warned that Omicron will dominate in many countries across the region within weeks and called booster shots the single most important defense against it. And last but not least, McDonald's in Japan said it will only sell small-sized French fries for a week starting from Friday due to a shortage and delays in potato imports. Flooding in Vancouver and the global supply chain crunched caused by the pandemic means that McDonald's is dealing with a hot potato, Joe.
All right, Claudio, thank you so much. Smaller hot potatoes right now.
I know.
The Biden administration says millions of people will have access to free at-home COVID testing kits starting in January. The decision comes as Omicron rapidly spreads throughout the country, overwhelming testing sites in several major cities. President Biden had this to say about the new testing initiative.
So I'm announcing today the federal government will purchase 1/2 billion, that's not million, billion with a B, additional at-home rapid tests with delivery starting in January.
Well, states rush to replenish their COVID testing supplies. Colorado is continuing to offer free at-home tests. It's a program the state started in September, 2 months before Omicron was first reported in the U.S. NBC News medical correspondent Dr. John Torres joins us now from Colorado with more on this. Dr. Torres, you've done this test before. Walk us through how Colorado residents are getting these tests, and is there a limit on how many someone could order?
And Joe, like you talked about, they actually started this back in September and started really pushing out the information about a month ago to try and get more people to get these at-home tests. And so far, they have ordered 2 million tests here. They've actually distributed 1.3 million. And so they're having really great success at doing that. And it's actually pretty simple. There's a website you go to and you register by your email. Once you do that, they send you a link. You go to that link, and that link provides you the ability to register with your home address and all the information you need. And then they send you the test. I did this last week on the 16th. I went ahead and registered, got the email to register on the 17th fully, and ended up getting my test on the 19th. So it was 3 days later. And what they do is they send you 2 boxes. Those boxes are the ones you're seeing there, and there's 2 tests per box. So there's 4 tests, and you can do that twice a month at this point right now. And they say they might ramp that up a little bit. So it's very easy, and it's one of those things that has been very successful here in Colorado and has been successful too, I think, at keeping the numbers down. Because if you look at our waves, they haven't been as high as some of them in other countries, especially, or in other states, especially neighboring states around here. So I talked to them last night at the Colorado Department of Public Health and Environment, and they're very happy with this program. They plan to continue the program even once the federal government starts their program, but they're waiting to see what they do.
And those Binax tests are hot commodities right now. Now, Dr. John, we're seeing several states across the country report wait times for COVID tests are hours long. It's hard to find those at-home rapid tests, too. So how does handing out these free tests in Colorado help the state actually stop the spread of COVID? You say they're seeing some success. How does that work?
And so what they're doing is you are able to get these at the house, which means that you can do what a lot of public health experts are saying. If you're going someplace, well, number one, if you feel like you have COVID, you can go ahead and take the test, and you can get at least an initial idea whether you have it or not. And then if you're positive, go ahead and get a PCR test to confirm that. But also, if you're going to an event, if you're going to a gathering, you can have people get tested before they go there. Just say, hey, we're going to have this gathering next week. Go ahead and order your test today. Here's how you do it. Take it right before you come to my house. If it's negative, come on over. If it's positive, don't. And that gives them the ability to keep at home if they're sick, not spread it to other people, and then go there with some confidence that they don't have it. But like I mentioned, you get your 2 boxes here. I'm saving mine until we get our gathering here coming up soon. And it gives you that confidence and that ability to understand whether you have COVID and make sure you don't spread it to other people.
So if you do an at-home test and you get a positive result, what is it you're supposed to do? And is there somewhere you're supposed to report the results?
And Joe, that's the interesting part is when you sign up for it, you have to check a box saying that you will give them your test results once you get your test results. And then you can go to the Colorado Department of Public Health and Environment to their website, and there's a way you register there your test results. If it's positive, then they'll go ahead and contact you. They'll talk to you about what you need to do. At the same time, you can go ahead and get a confirmatory test beyond that. Isolate yourself in the meanwhile to make sure that, again, that you don't spread this to other people. But it's an easy system to use. Again, it's been there since September. They've been really pushing out the information over the last month or so, and a lot of people are getting those tests here in Colorado, Joe.
Interesting, and perhaps a model for the country. Dr. John Torres, thank you so much. Appreciate it. Coming up, millions of American families are now losing a critical financial lifeline, the child tax credit.
That money made a difference on what we could get for our family.
With the final checks going out this week, NBC's Stephanie Rule has more on the likelihood this benefit could come back in the new year. Plus, refunding the police. Several cities that chose to slash police budgets in the past year are now putting that money back. The reason behind the switch, next. Several cities made major budget cuts to their police departments following the 2020 racial reckoning. But what once seemed like a major step forward for activists is now becoming a more complicated reality nearly 2 years later. NBC News correspondent Zincle Esimwa explains why municipalities are reversing their decisions and what it means for the future of policing.
George Floyd's murder by a police officer in 2020 sparked calls to defund the police in cities around the country. Oakland was one of them. Its city council supported reducing the city's police department budget by 50% over 2 years, July 2020. But this week, the council, including Lauren Taylor, voted to partially refund, approving 2 police academies.
We have a situation where we have unfortunately allowed our police staffing to get to levels that are lower than, frankly, we need for our residents.
Likewise, in Floyd City, Minneapolis, council members once pledging to defund or reallocate funds from police, now choosing a different position.
Why change your stance?
I never changed my stance. Crime has increased significantly in Minneapolis as it has all around the country.
Andrea Jenkins and 9 other council members voted to partially refund the Minneapolis Police Department by millions, restoring it near to levels held before Floyd's killing.
We must have a both and approach to public safety.
Jenkins and Taylor say that both and approach includes both adding funding to alternative safety measures like mental health services, which take time to develop and implement, and funding police departments.
Why are cities suddenly refunding the police?
During the pandemic, there has been an increase in crime. That has sparked concerns of a crime wave in which police are often a short-run solution.
The U.S. murder rate hit its highest single-year increase in a century in 2020, up by 30%. Now, many cities are changing course. NYC approved a budget shifting $1 billion away from police June 2020.
I vote aye on all.
1 year later, $200 million restored. Portland City Council cut $15 million from its police budget June 2020.
I am proud to vote aye.
By November 2021, the council unanimously approved adding $5.2 million back to the budget. Baltimore's mayor, who once slashed the proposed budget by millions, now proposing a $27 million increase. Leadership of these cities cite pressures outside the defund movement. In a statement, a spokesman for Baltimore's mayor said, in part, the increase was driven by personnel costs. A spokesperson for Portland's mayor told NBC in part that they were required to cut some funding across the board. New York's mayor did not immediately respond to our request for comment. This new wave of reallocating funds, just as the public stance on defund, is also shifting. More adults now in favor of increased policing. Still, issues that reignited calls to defund remain, with continued public outrage at Black people disproportionately killed by law enforcement, and fatal police encounters repeatedly caught on camera.
These communities in which they're over-policing and aggressively policing, they also need more support, more resources.
Many activists still calling for radical criminal justice reforms.
So was it all talk last year? Were you all just appeasing activists, but knowing that it might not happen a year later?
It is an aggressive goal, but something worth marching toward is having less investment into the punitive side of public safety.
And officials like Taylor and Jenkins say defund the police, an issue often framed in black and white, is anything but.
We need police to be a part of the community, to work together with Black and brown communities and not as an oppositional force, and really be a part of helping to build a better society.
Thank you to Zincle Esimwa for that report. Now for a look at the battle to extend a popular pandemic relief program, the monthly child tax credit. The final checks went out last week. Now millions of American families are reckoning with the loss of a critical financial lifeline as talks of an extension stall on Capitol Hill. NBC News senior business correspondent Stephanie Rule shows us what's next for this benefit.
Good morning, girls.
We met Connie Sierra right as the child tax credit was increased and changed from a once-a-year benefit to a monthly check.
If we're getting it every month, we can use it towards all the little things that are affecting us now.
6 months later, she says it's really helped her two daughters.
That money made a difference on what we could get for our family.
What did you spend that money on?
Back to school clothes, haircuts, shoes.
The change in the tax credit was part of last March's pandemic relief bill. Families received $300 a month for every child under the age of 6 and $250 for those up to 17, phased out as families earned more.
Families in every single state are using this child tax credit payment for food. It is the most common use.
The Biden administration wants to extend the tax credit for another year as part of the Build Back Better Act. But not all are on board. Some Republicans and even Democratic Senator Joe Manchin raising concerns about the cost of the tax credit, putting the entire bill in jeopardy.
I cannot vote to continue with this piece of legislation.
Now President Biden says he plans to continue negotiations with Manchin.
We're going to work with anybody who's interested in taking steps to lower costs for the American people, whether it's on child care or elder care or health care.
The final checks have gone out to families. More than 61 million children have benefited. Last month alone, the tax credit kept nearly 4 million children from poverty.
That, just to put in perspective, is sort of unprecedented levels of child poverty reduction that we see in the U.S. in general, and especially through a single policy.
Unless there's an extension, the new year will bring new challenges for families like Connie's.
I think we'll have to figure out a way to cut back in other aspects.
Stephanie Rule, NBC News.
Time now for our CNBC Money Minute, the biggest financial headlines of the day and why they matter to you. Bertha Coombs is with us. Bertha, good morning.
Hey, good morning, Joe. The CEO of Delta Airlines is asking the CDC to cut the amount of time that fully vaccinated people who get breakthrough cases of COVID have to quarantine. In a letter, he cites the impact current guidelines are having on the airline's workforce. We've heard from hospitals on that as well. He's asking for the quarantine period to be cut from 10 to 5 days and suggests that those individuals could end isolation with appropriate testing. Now, the CDC has not commented yet, but you can expect a lot of companies will be watching that decision closely. Meantime, the TSA says that it's going to start supporting Apple Wallet IDs at 2 airports beginning in February. Which 2 airports? Well, the agency hasn't said which ones yet, but if successful, that pilot program will expand to 2 more airports in other states in March. Instead of TSA staffers examining your physical ID card and verifying flight information, a machine will automate the whole process. Travelers will tap an NFC reader or use a QR code scanner at security checkpoints, and then TSA will just oversee and validate that process. Meantime, Adidas and Microsoft have teamed up on a final pair of Xbox-themed sneakers to mark the 20th anniversary of the game console. Unlike the previous versions, the Forum Tech Boost Series X shoes are available to purchase. They're on sale from Adidas and other retailers and are currently in stock on Microsoft.com, selling for $140. The design and coloring mimic the current version of the Xbox Series 10, with black netting and a green liner and a sphere Xbox logo on the side. Now, I laugh about people having to have shoes to play Xbox, but, there is nothing like the smell of new shoes, that new shoe smell. Love it.
That's true. And maybe they help. Maybe they make you a better player. Who knows?
Right? It's the shoes.
Yeah. All right. Thank you, Bertha. Coming up, we have 3 days until Christmas, and if you still don't have a tree, don't worry, there's a new way to get your hands on one. Just rent it. Our own Molly Hunter takes us to a Christmas tree farm, letting people take a real tree home and then return it after the holidays. Plus, a real secret Santa. A college professor receives a package with nearly $200,000 cash inside.
I'm thinking, wow. I've never seen this kind of money ever in my life.
The mystery behind who sent it and what this professor now plans to do with the cash. You're watching Morning News Now. For many Americans, a Christmas tree is one of the most important holiday items you can have. But after the holidays, these trees often end up in landfills and leave behind a big carbon footprint. Well, now there's a new way to dispose of your Christmas tree and help out the environment at the same time. NBC News foreign correspondent Molly Hunter shows us how.
Good morning from a Christmas tree farm in the Cotswolds. Now here you come, you pick out your dream tree. 3 weeks later, you bring it right back so it can keep living. Take a look.
With just a few more days until Christmas, there are still lonely trees waiting to be brought home. But this year, instead of buying a freshly cut tree, well, here comes rental CLAUS.
It feels so good to keep your tree alive. There's something slightly gets in your heart.
And Paul Keene is full of heart.
You have more people who want to rent than you guys can supply right now.
Absolutely, yeah. No, by far, yeah.
Why is that right now, do you think?
I think everyone likes the idea.
Today, about 80% of their customers walk away with potted, pre-loved rental trees. After 3 weeks of holiday festivities and a little ornament wear and tear, they bring them right back here.
They'll get a little prune up in January, make sure they're ready to go for another year, and we'll look after them again.
Americans buy about 30 million Christmas trees, and while some will be composted and recycled, most will wind up in landfills. The average carbon footprint for a natural tree thrown into a landfill is almost 13 times more than a potted tree that's been replanted. Plus, out here, there's just more variety. There are fat ones, skinny ones, trees with character, and this slightly lopsided 6-footer.
Giving it a splint already, and he's still trying to go around the corner. He could still say, I'd be all right.
Not unlike Charlie Brown's famous Christmas tree. But thousands and thousands of rental CLAUS customers having more joyful luck.
It's like this relentless optimism. This could be better next year. You could be even better next year.
Yeah, they can catch us out. They're as individual as you and I, and they all do their own thing.
There's a tree for everyone. Oh my God, it's so cute!
Loyal annual customers get so attached, they start naming their trees.
You found this guy. Has it grown since you've seen it last year?
Do you know what? I'm actually not sure. I thought it might be a bit bigger, actually.
This is Franklin the Fir, and for Sophie, the choice to rent was easy.
Yeah, we just didn't want to cut down another tree.
Potted trees require less land, less fertilizer, and rental CLAUS says they can last up to 10 years, all the while living their best lives.
Now, not all of these trees will get to spend another cozy Christmas inside. When some of these trees reach a certain height, they will either be planted into the ground to grow even taller, or they will be put out to pasture to start decomposing. I'll send it back to you.
All right. Love that story, Molly. Thanks so much. Now, a Christmas miracle of sorts came a few days early for one professor at the City College of New York. A whopping $180,000 left in a box. Now the hunt is on to figure out who the secret Santa is and how to thank that person. NBC News correspondent Carrie Sanders has more.
Physics professor Vinod Menon is all about solving mysteries of the universe. But who sent him and City College of New York this box filled with cash is a mystery unsolved.
You see this money and you're not sure how much it is, but what are you thinking?
I'm thinking, wow, I've never seen this kind of money ever in my life.
$180,000 unexpected dollars. A letter with a cash set in part. Assuming that you're a bit curious as to why I'm doing this, the reason is straightforward. A bachelor and master's degree in physics from City College resulted in a long, productive, immensely rewarding career. Adding to the improbable story, the box with $90 in postage was mailed in late 2020, but because of the pandemic, it sat unopened for 10 months.
Somebody trusted the post office, somebody trusted the mailroom, somebody trusted everyone, the whole system. And that's another great part of the story.
The FBI investigated. Agents told administrators the money's legit. The name on the letter and address label, Kyle Paisley. But there's no City College graduates with that name.
Is the name an anagram?
At some point, it dawned on to me that, the person doesn't want to be found. Why should I do it?
A physics professor with newfound scholarship money and a mystery he now chooses not to solve.
Joe, the hypothesis now is $180,000 will be able to fund 2 scholarships a year for the next 12 years. And then if those graduates continue to donate, well, it'll be the physics holy grail, perpetual motion. Joe?
All right. A feel-good mystery. Carrie Sanders, thanks so much. That does it for this hour of Morning News Now. The news continues right now.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.